Hi, Valerie.
Oh, I didn't even see it there. So did I. I had to pick up that prescription. I was rolling up. Here, make sure you get one of these.
Yeah. Yeah.
How are you?
Yeah, get the display board with one of the flyers.
Or we'll do it like this. How are you? To advertise. There we go. So they come around and do a video of the walk too.
My friend was here, I saw so the light didn't go.
Now I'm going home. Sure you are. I gotta go home. Sure you
Yeah, because they're irritated. All right, you're good to go. You're welcome. Yeah. It's hard to
How are you doing?
But if you guys are looking in the mirror, you know, check out the back of the too. Good. It helps you.
I saw that word right here.
I know, I should have been here.
I live right through the middle.
Yes. Hold on, okay.
I never know when I'm in here.
He did find us.
Did he? I know he was out there. Oh my gosh, you know, we really get some into everything.
Yes, that's the bad part.
No, we don't. So we actually going up the road, you know, I know we have to pick up those. I mean, there was a bad period. That's how, you know, I hear I get, you know, it was my part, and I was gonna get to that, but I didn't.
That's a feature. He doesn't want
That's
to
what I did, because I went in.
Rather him do it.
Everybody gets
Well, next time you're ready, we take walk-ins too, so.
Yeah, I know, yeah. Because I've been curious, I don't know most of the time.
And there you go. Thank you.
Well, I've been,
And there you go. Oh, sorry. Thank you.
Let's do something. I don't want you to be unhappy. I really don't.
That with daily life. So we're going to just show you some general stretches head to toe that will help keep you flexible. And feel free to join in because we're going to show you guys modifications so that you all can keep yourselves flexible. So first one we're going to do is what we call an upper trap stretch. You can do this one seated or standing. And what you're going to do is you're going to just kind of brace your arms. You can do it in front of your body. And then you're just going to lean your head to the side. So you're going to hold for about 20 seconds. Is everyone feeling the stretch? If stretch where if it hurts, just feel free to raise your hand and we'll come by and try to help you modify the stretch. And then we're gonna switch to the other side. And then we're gonna switch back to the other side. And then one more time back to the other side. And you just want to take your stretches to the point where you feel a gentle stretch. You should not have any intense pain with any stretches. Very good. And then the next stretch is a very important one because most of what we do throughout the daily life nowadays is sitting, reading, texting, computer work, things like that. Your neck is always in this forward flexed position. So the next one, you're going to put your hands just on your chest, and then you're going to lean your head back, and you should feel a stretch right along the front of your neck. That amount of time will allow actual muscle length change so that you get a permanent change in the length of that muscle to promote more flexibility. Now, does anyone have problems with this one making them dizzy? Good. Now we're going to look back down. And then back up. Good, and back down. And then one more time back up. Very good. So the next one we have is very good for opening up the chest. We also tend to be more rounded shoulder as we age, and we get that little bit of hump back. We don't want that because then you just start shrinking, and push yourself forward, and you're at more risk for falls. So the next one, actually, if you all don't mind standing up, we're going to find a corner.
I know.
For those of you that don't have a corner, you can stand against the wall with one arm just out to the side. And what you're going to do is you're going to put your arms up kind of like this, just kind of shoulder height, and then you're just going to lean into the wall very gently. You should feel a stretch right across the front of your chest. And so for you guys, everyone can take a break. I wasn't watching the clock that time. It was so and if you're against the wall, with just one arm, then we'll just switch sides. And then if you're in the corner, go ahead and lean back in. We're going to do it about 3 or 4 times here. And let's go ahead and we'll take a break. And then let's try it one more time. Go ahead and lean into that wall. Or turn your body away if you've got just one hand on the wall. And we can take a break. That's right. Did everyone do okay with that stretch? So I like to do stretches 3 to 4 times and hold them for 20 to 30 seconds. So the next stretch we're going to do is a tricep stretch. So we're stretching the back of the arm here, and you can either stay where you're at or return to your seat, either one. But you're going to bring your arm up overhead and then bend the elbow. And if you're not feeling much of a stretch, use your other hand to push that elbow back towards your head a little. Can you feel a stretch in the back of your arm here? And let's go ahead and let's switch arms. You doing okay? Are you feeling the stretch? Good. We're going to switch arms again. most of these stretches that we've included, you can do sitting. There's a couple of, the quarter stretch and then a couple of leg ones that we'll have you stand for, but most of them, we tried to come up with ones that you could do sitting. And then we're gonna switch arms one more time. Very good. So arms rest on down. And then the next one, you can do sitting or standing, but we're gonna try to stretch the side muscles out. And this will help allow you to keep your rotation so that you can turn and reach to grab things. But what you're gonna do is you're gonna take your hands and you're gonna just reach overhead and kind of lean to the side. So if you have a hard time balancing, this one you can do sitting, and you would just sit and then lean to the side. Everyone feeling the stretch on your side here? Very good, and we're gonna lean to the other side. Good. Let's let the arms down for just a minute. Does anyone's hands go down doing that? Everyone's good? And then we're gonna do one more to each side. Lean to the side. And then one more time to the other side. Very good. Our next one, the picture in the packet shows the exercise being done kneeling. You do not have to do it kneeling. I just couldn't find a great picture of someone standing doing it. But what you're gonna do is you're gonna stand and take one foot and just step forward, and then you're just going to kind of lean the hips forward. You should feel a stretch on the front of the back thigh. Everyone feel that? You guys feel the stretch back there? And this one is very important for hip health, because when you're sitting, the front of that hip gets very, very tight, and it's gonna start shortening your step length. So when you're walking, your steps are gonna start getting smaller, and it's going to tighten down that joint, causing a little bit of grinding. And then we're gonna switch and put the other foot forward. And if you're having any troubles balancing, you could do this next to the kitchen counter or a stable surface like that so that you can hold on while you're doing it. Very good. We're going to switch again. Good. And then we're going to switch one last time. Very good. So the next one we have is to stretch the front of the thigh. And this one a lot of people find difficult because you're standing on one leg.
So you're gonna want something to hold on to.
Yeah, so you will want something to hold on to. But what you're gonna do is you're gonna stand and then try picking up the other leg. Now, if you do not have this kind of range, that is fine. What you're gonna do is you can set up 2 chairs and you can hold on to the back of one for balance and then set your other one up there to get a stretch here. You know, and even if this is too much, if you have a step stool, just anything to prop that foot behind you a little bit so that you get a little bit of stretch. And then as you get more flexible, you can raise that up. Good, and let's go ahead and let's switch feet. You can also do this one laying down in bed if you have a belt or something you can put on your foot, you can lay on your side and then pull the belt behind your back to get a little stretch. So the next one we have is one that I'll have you sit for. You can grab a chair. And what you're going to do is you're going to extend one leg out straight, and then you're going to hinge at the hips. And this is the important part. You don't want to just bend at the back. You want to keep your back straight and hinge at the hips forward. So you should feel a stretch on the back of your thigh there. Maybe even behind the knee and a little into the calf. And this one is actually very important because this muscle hooks into your low back. And so if it gets tight, it makes your back change positions, which can cause some problems if you have any arthritis buildup back there. And we're going to switch feet. You're going to hinge forward at that waist. And we're going to switch feet one more time. Very good. And then the last stretch we have is what we call a calf stretch, and I'll have you just find any spot on the wall. And what you're going to do is you're going to put your hands against the wall. You're going to step 1 foot forward, and then just kind of lean forward into the wall, and you're going to be stretching the back leg's calf. And we're going to switch again. And one last time. Very good. So those are the exercises that we wanted to kind of show you guys today to keep just general overall joint health. If you all have any questions, feel free to stay, ask, and then make sure you have a handout so you can have the exercises.
Well, good morning, everyone, and I'd like to welcome you to our lecture series for the 2015 Women's Health Fair. As always, we're delighted that everyone was able to attend, and even though this is a little bit more rough weather than we've had the last few years, we appreciate your valiant efforts in coming to join with us and celebrate Women's Health Month, which is February, is designated by the American Heart Association. We've made an effort in February of every year to make a special effort, and it's really almost a year-long effort to organize a women's health fair. It's usually the last Saturday of the month to honor women and in our community, and to put together a very large symposium with lectures, booths, and to help us not only discuss and present information on all aspects of medical issues, particularly focused on women in different aspects of medical disease, but specifically focusing on women in heart disease. As you know, upstairs we have screenings and we have informational services for you. And every year I like to give a talk on the various aspects of heart disease, cardiovascular disease, and as you know, many of you know, my area of expertise and my passion is prevention. And this year I like to discuss issues particularly related to stress and how stress management affects the heart and the cardiovascular system. And we're going to be talking about that for the vast majority of this discussion. The first part of the talk, I'm going to quickly review general risk factors, what we do as we come in and evaluate you if you or your physician or provider are concerned that you have heart disease. And then the second half of the talk will specifically focus on issues related to stress, how we found the medical studies and evaluations, stress in different aspects can affect your cardiovascular system, and what we can do about that to help you address those issues and intervene and help you a healthy life and a happier life, and integrate the stress issues into your entire management plan. And our goal of medical therapy here at St. Genevieve County Memorial Hospital is really an integrated approach. You know, we just don't treat the heart, we just don't treat the blood pressure. We try to treat everyone on an individual basis. And stress management and psychological issues are a very, very important part of the care plan of each individual patient. As you'll see, we take this very seriously, and we don't treat it as an isolated issue, and we try to integrate it into everybody's care plan. Okay. So the titles we came up with: Reduce Your Stress to Renew Your Heart. And that's really to keep your heart healthy, wealthy, and strong. And you all know that I have a passion. Those of you know me know I have a passion for art. Birthday present when I turned 50 from a friend of mine who's an artist, Dominic Pangborn, a very good friend of mine. And I had this in my office for years, in my St. Louis office in the wall of my waiting room, and I like to put this on my slides now. He's a dear, dear friend of mine, and I like to pay tribute to him, as I was really surprised when he not only came to my party, my 50th birthday party, but he gave me that picture for my party, for my birthday, and I really was quite honored. I showed this slide before, and kind of talking about stress, I thought this was really a good way to start. About 15 years ago, I was with my family in Hawaii, and a lot of people do this, about 2:30 in the morning, you wake up and you gather your clan together to try to go up to the top of Haleakala volcano, and then as the sun rises, you take you do a bike ride down the volcano. Well, you go up to the top of the volcano, you watch the sunrise, then you do a bike ride down. Well, one issue of stress is getting my 8-year-old up at 2:30 in the morning because he didn't want to sleep. So that was kind of a stressful experience. So this reminds me of stress, but the issue was getting him up, getting him into the van, and that was quite an experience. But at the end of the day, as we'll see at the end of the talk, it's well worth it. So sometimes getting through stressful experiences has its benefits. And stress isn't necessarily a bad thing. Sometimes stress helps you focus. And you know, we all know that sometimes it's deadlines that gets us to places. And this slide reminded me that stress isn't necessarily a bad thing. You know, I don't know if you ever have dealt with lawyers. A lot of times we've all dealt with lawyers. Lawyers kind of don't do things until like it's a deadline, right? You talk to a lawyer, you have to do something, you're ready to buy a house, you're ready to negotiate something, a deal. They don't do anything till the last 3 days. Then all of a sudden, the whole deal gets done. You know, they kind of focus at the end. So it's the stress, it's the push, we have to get it done. So stress isn't necessarily a bad thing. And we'll talk about how that push, how that extra adrenaline you get, how that helps you focus. And we'll talk about the positive aspects of stress. There are some positive issues, but we want to also make sure that the stress in our life doesn't detract from our overall healthy lifestyle that we want to maintain. I want to remind all of us that cardiovascular disease is a very serious condition in our society. About every 30 seconds, every 30 to 60 seconds, a man or a woman dies from cardiovascular disease. That's about 2,600 deaths a minute. And this is what happens, which is a blockage in a blood vessel. And that blockage, and it doesn't matter if it's in a heart, in a brain, or in the blood vessel of your body. This is in the aorta. It's all the same. Okay, if it happens in the heart, it's called a heart attack. If it happens in the brain, it's called a stroke. And if there's a tear because of a blockage in the blood vessel, the aorta, it's called an aortic dissection. And these are travesty, this is acute medical emergencies, and this is what we want to prevent. So from seeing your doctors on a regular basis, getting regular checkups, having your what we call risk factors addressed, getting your blood pressure controlled, having your cholesterol managed, getting in a diet exercise program, we can significantly decrease the risk of these devastating events occurring. Now, atherosclerosis, or abnormal blood vessels, develop from a very young age. And that's an important point. When we're born, our cholesterol is 35, and especially when we looked at studies, even when babies start drinking breast milk, okay, versus soy, breast milk babies, which have fat in the breast milk, their cholesterols go from 35 to 70 within about 6 months. Babies who are fed soy-based milk, their cholesterol stay low. So there's a significant element of diet that enters into it. But when we look at specimens of young, otherwise healthy men, this is an example of an autopsy specimen of an aorta from an 18-year-old who had no other risk factors, who died in a motor vehicle accident. We already can see that there is abnormal blood vessels, streaky atheromatous irregularities in the aorta of an 18-year-old who unfortunately died in a car accident. So we see these abnormalities occurring at a very young age. I brought some examples, and these are obviously not real aortas, but these are examples that I show patients in my office. This would be an example. We can pass these around. This would be a normal aorta, and these blood vessels are common through the body. This would be also an example of a blood vessel in your heart. This would be a normal blood vessel with the 3 layers, no evidence of fatty streaks with good flow. This would be an example of a blood vessel with a mild plaque. We see the yellow fatty deposits starting to occur on the side, but there's still a large area available for blood flow to go through for the body. Over time, what happens is that area of what we call plaque, of irregularity, starts to get thicker, starts to grow, and what happens is that there's inflammation on the border zone between the atherosclerotic plaque and where the blood flow goes, and a crack can occur. And then we get a blood clot on top of the plaque, and that blood clot can clog up the artery, and that's what causes a heart attack or stroke. So it's usually a clot on top of an atherosclerotic plaque that actually causes the heart attack or stroke. That's why we'll commonly recommend people take an aspirin to prevent these events, because we have an abnormal blood vessel, but it's a clot. It's a blood clot problem on top of abnormal blood vessels that actually cause the issue. So I could pass these around and you can take a look at those, and we can have any questions, we can discuss that later. Just a couple quick points on heart attacks, and a couple quick points on particularly on heart attacks in women. Common symptoms are chest pain, pain in the upper body, shortness of breath, cold sweats, nausea, lightheadedness. One thing that's very important is that symptoms in women, particularly women over the age of 60, happen to be commonly are different than symptoms in men. Men generally have the substernal chest pressure, which they say it feels like an elephant on their chest, that radiates to their neck and their arms and their back. Women much more commonly complain of symptoms of shortness of breath, weakness, fatigue, and nausea. So symptoms in women are more commonly weakness, fatigue, lightheadedness, dizziness. Those are common symptoms we more commonly associate with heart failure. Okay, so if you have those type of symptoms, it's very important to discuss those with your medical provider. Okay, don't blow those off. Okay, and multiple studies, and I discussed this last year in this talk, is that women, and it's been well described, when these symptoms present in women, okay, there's generally a delay compared to similar symptoms presenting in men of 30 to 40 minutes or so compared to the onset of symptoms in men presenting to the emergency department. And if there's a delay, we can't initiate treatment as quickly as we can in men. So women present to the first medical provider later than men by 30 to 60 minutes. And that's a very important feature because the sooner you present to your provider, the sooner we can institute treatment. So if you have symptoms of acute onset, new onset, nausea, vomiting, acute weakness, dizziness, lightheadedness, that's otherwise unexplained, you need to call your provider if it's during work hours or go to the emergency department. If your stomach can tolerate it, you should take an uncoated aspirin and you should call your provider or go to the emergency department. Because especially in women, those could be symptoms of a heart attack. This would be an example of a blockage in the angiogram if we would take you to the catheterization lab. Here is a abnormal blockage in, not just in the cartoon toy I gave you, but actually in an artery. And here you see it's significantly blocked. This would be a normal blood vessel. This is a blocked blood vessel by about 80%. And if it totally blocks off, if the clot went here, you wouldn't see any blood flow at all. And then what we do is we put a catheter in here, and we open up the catheter, and we put a stent in here, which is a metal scaffolding to quickly open up the artery and increase blood flow. But we have to do that as soon as we can. And that's what a stent is. So we want to treat your heart attack as soon as possible. And we can also miraculously do this in the brain now. We can treat strokes within 3 hours also with a similar treatment. So even if you have acute neurologic symptoms, if we can treat you within 3 hours, we can do this miraculous treatment quickly in the brain also. It's unbelievable the type of technology and treatments we have. But it's very important to come into the emergency room or call your provider quickly when symptoms develop. So this is what a totally occluded artery would look like. You have a clot on top of an abnormal blood vessel. So we go in with a catheter, we go right through this and open up the catheter and put a metal stent in here that increases blood flow. And that can be done very rapidly. Now we don't do those procedures here, but we can get the medicine on board and get you sent to a facility like Missouri Baptist, Barnes, or St. Louis University very rapidly. And once we let them know you're coming, they have the catheterization suite already available. And we have the pre-medicines on board. So we already have those medical protocols available. But if you just went there directly without them knowing you're coming, there's going to be inherent delay. So if you're here in St. Genevieve and have symptoms, you need to come here to the emergency room, and then we'll get the ball rolling to integrate your care with those facilities. And that's part of the work that I've been working on, is integrating the care from our hospital to those other tertiary medical centers. And we've been very successful on getting those plans in place. Now, what do we do as physicians? And providers, there's three things we always do. We evaluate you, we assess you, and then we treat you. And we have to do it in this order. It sounds mundane, but we have to do it in this order. We have to evaluate you, okay? And that's done by a history and a physical exam. And then we have to assess the information we get. And then we have to treat you. Now, this sounds simplistic, but think about it. This is different than somebody just calling up on the phone and saying, I have the symptoms, give me a Z-Pack. You see, that scenario wouldn't work with this kind of process, because we need to see you, we need to evaluate you, because 50% of the time, when somebody comes into the office to see me, when they're referred for chest pain, it's not a cardiac problem. It's something else. It's asthma. It's esophageal reflux. it's something else. When somebody comes in here to see me for high blood pressure, they're always worried they're gonna be taking more medicines. I would say 80% of the patients who leave my office for an initial evaluation of high blood pressure leave with less medicines than they came in with. Because I can combine medicines, or they're taking medicines that are actually interfering with the medicines they're taking and actually causing their blood pressure to be elevated. So it's very important for us to see you and to bring your medicines in with you when you go to see the medical provider. So please just don't bring a list, bring a bag of your medicines with you, at least the first time, so we can see exactly what you're taking. So this triage of evaluate, assess, and treat is a very important process. So I really like this cartoon a lot. It's an old one, but I use it a lot. Give it to me straight, Doc. How long do I have to ignore your advice? But this follow-up slide is really important. Look at this. By the time we make the diagnosis of diabetes, by clinical criteria, by blood test, this person has had diabetes for 10 years. By the definition, the lab definition of diabetes, which is a fasting blood sugar of 126 on two tests, or an abnormal glucose tolerance test of greater than 60 over your fasting, this person has had diabetes for 10 years. So the answer is, to the first cartoon, you don't have any time. Because by the time you're sitting there in the doctor's office, whatever process you have has been going on for a while. So the answer is, there's no time like the present. You have to start your evaluation then. Does it mean you need to start treatment right then? Not necessarily, because every case is individual. So you can't just not treat anything, you can't just not evaluate. It's very important to reassess your condition when you go and see your providers or see your specialists or your consultants. So a lot of conditions, especially chronic conditions, high blood pressure, diabetes, asthma, those type of conditions have been going on for a long time before you actually see your provider. Now, the reason we screen is we want to prevent things. We want to check your blood pressure. We want to check your cholesterol because we want to prevent a heart attack and stroke. Because the most important risk factor for a devastating, lethal heart attack or stroke is the fact that you already had one. So we want to prevent the first one. Because once you have a heart attack or stroke, the most important risk factor for your next one is the fact that you already had one. So we want to prevent the first one. So the key thing is prevention of your first event. Now we can commonly prevent your second event, but we want to prevent your first event. So that's why we want to do screening. So we'll do lots of tests early on. But we want to be prudent about what tests we do. We don't do every test in everybody. Each test is individual to you, to you, to you, and to you. But we have to do testing to figure it out. Commonly, we can't just guess, because that's not the best thing in your interest. And as I mentioned earlier, the cardiovascular system is connected. The blood vessels in the heart, in the kidneys, in the brain, and the leg are all the same blood vessels. So the cholesterol circulating in your body is going to affect the legs, the heart, and the brain. Okay, so we have to, just because you had a heart attack, doesn't mean that your brain isn't involved. Or if you've had a blood clot or problem with circulation in your legs, doesn't mean your heart's not involved. That's why we have to evaluate it all. A very common scenario is Dr. Cox in Festus is going to be operating on a patient because of blood circulation problems in the legs. So he sends a patient to see me to make sure their heart's okay. Because he knows from historical treatment that 50% of patients who have severe enough blockages in their legs have blockages in their heart that need pre-treatment to make the surgery safe. So we have to make sure their heart is strong to tolerate the surgery on their legs. Because he can treat their legs, but he doesn't want them to die or have a serious problem in anesthesia. He can put the stent in, he can put the graft in, whatever he has to do, but it's the anesthesia that's going to be a problem. So I have to make sure their heart is strong to get them through surgery. So that's why we work as a team. And that's why the team-based approach is always important. And that's how we work here. Risk factors we talk about are smoking, smoking, hypertension, we're going to talk about stress. And these risk factors are multiplicative, okay? They're not isolated. When you have hypertension alone and diabetes, look what happens when you add the two together. 1 plus 1 doesn't equal 2. 15 plus 15 doesn't equal 30. Your risk triples if you have hypertension and diabetes, because the effects become so much more severe. When you have high cholesterol, high blood pressure, and diabetes, okay, your risk is, you know, what is it, 6 or 8 times higher than if you have either one alone. And smoking's not even on here. Smoking blows this graph up through the ceiling. So it's very important to have all these addressed. Smoking is far and away the #1 risk factor that's avoidable, okay? When you stop smoking, smoking goes away as a cardiac risk factor within 6 to 12 months. It doesn't matter how long you smoke. And the reason is, smoking is an acute toxin on the cardiovascular system because it causes blood clots, it squeezes down on the blood vessels, and that's why you have a heart attack or stroke, okay? It's different than the risk of smoking for lung cancer and esophageal cancer and pancreatic cancer. That's how much you smoked your whole life. But smoking as a cause of a heart attack or a stroke has to do with acute smoking. So if you stop smoking, it doesn't matter if you smoke for 30 years, within 6 to 12 months, your risk as a smoker is like you're a non-smoker after 6 to 12 months when you stop smoking. So it's critically important that you stop smoking. So, you know, there's all types of, so the benefits of quitting smoking, within 6 to 12 months, your risk becomes that of a non-smoker. It's an acute toxin on the heart system. Cancer risk will still continue, and you have to be screened. Your cough will go away. You'll breathe easier. You'll be more physically active. You can exercise, et cetera, et cetera. So, you know, we see this all the time. You know, honey, I'm so proud of you haven't smoked for a week because he's on a ventilator. You know, and people think going from light cigarettes, which are less than tar, are better. No smoking cigarettes is good for you. You have to stop. And we have all kinds of programs to help you. There's medication, there's, you know, the e-cigarettes are still no good because they have nicotine in them. But, you know, nicotine is better than tar, but still, you're going from one addiction to another. So we have to work on that. Diabetes is very important because if you're a diabetic, it's similar to having a previous heart attack. So we have to work on that aggressively. So I want to kind of get through this and get to the stress stuff. So let's kind of skip through this. High blood pressure, we want to be, we want to treat your blood pressure. You know, as you know, you get your blood pressure checked every time you go to the doctor, you go to the dentist, you go get your gas changed in your car these days. I mean, everybody checks your blood pressure, okay? That's very important. I'm going to actually go through all this, and I'm going to go to the stress stuff. Just one thing I want to say on diet and exercise. The supersize stuff has gotten a lot of press, and as you'll see, as of 2015, those huge supersized drinks are actually now illegal in McDonald's and in Burger King and all those types of facilities by the government. The government just published a 517-page paper on diet and nutrition. The actual guidelines are going to be published in the paper later this year. But there's a whole new set of dietary guidelines. And you've heard about the diet pyramid and all that. The whole new guidelines are gonna be published. And basically, it talks about portion size, it talks about increasing water, specifically our St. Genevieve County Memorial Water, for which you'll all get a bottle when you leave here for attending our lecture today. Water is the #1 recommended drink, okay? Getting away from sugared soft drinks. It's very important. Increasing protein in our diet, increasing beans and legumes and vegetables and fruits in our diet. And it's a monstrous paper. And I was actually looking at it with Mary Priscillius. There's new recommendations on vitamin D and calcium. She'll talk about that with you. It's important to get your vitamin D measured in the spring and the summer, because they mentioned that it could be about 1/3 less in wintertime because of the lack of sunlight. That was something I didn't know, I never really thought about. So she'll talk about that when you have your women's health review. It was a good thought. I never even thought about it, but she'll talk to you about that stuff. Okay? When you exercise, you have to exercise. Taking your doggy for a walk is good. You know, there's a threefold reason for this slide. A, it's get out and exercise. B, this is a plug for our June. We have a cancer awareness bike run that we do every year, usually the 3rd or 4th weekend. And you'll hear about it in the paper and handouts. And it starts here, and we go around the city. We could do walks, you could do bike rides, you could walk with your friends. And it's really a great, great event. And it raises money for our fantastic cancer center. And at the end, I picked up my little doggy, and everybody loves my little doggy. But the other point I wanted to make here, and this is the beginning of the stress section, which is that it's been well documented that elder people, particularly elderly people who have pets, okay, have a 3 to 5 year increased life expectancy than people who don't. So that's kind of what I wanted to show this. And it's absolutely true. It has to do with you have something to wake up for, you have something to do, you have something to love, you have somebody, it's unconditional love, and it's all that. So, you know, having a pet is really very important. So now we're getting into diet and exercise. So, and this is actually I think in one of your handouts when you talk about stress management. So a couple ideas on exercising, okay? Take your dog or your kids or your grandchildren out for a walk. Even if you walk 10 minutes a day, okay, that would be good. And the weather's bad, go to a mall, the grocery store. That's another suggestion, okay? You know, go out to the community center. It's a great place. It's very reasonably priced. We have a phenomenal, for a city like ours, we have an incredible community center, okay? Walk and talk, even if you're, you know, glued on the phone, just do your errands, you know, while you're going for a walk, okay? While you're watching television, you know, walk in the room, do stepping and walking while you're in the room, okay? What does this one say? Park farther away. This is a good one too. We recommend this to our employees. Park on the farther lot and walk if you can. Those extra 20 or 30 steps, okay, make a big difference, you know? And if you can walk an extra set of stairs, and sometimes it's harder if you have arthritis and things, and we understand that, but especially for our younger employees, we really recommend, here we only have one set of stairs, but you know, in other places, if you can take stairs versus taking the elevator, those little bits really add up over time. And you know, a big thing is to skip dessert and go for a 10 or 15 minute walk after lunch, okay? So that's another recommendation. Wrong way. Okay, let's skip that. Okay, now let's talk for the last 5 or 10 minutes on specific stress-related issues, and then open it up for questions. The word for heart in Latin is cor, C-O-R, okay? And think about it. What do we use the word core for? Core, the word core in English is derived from the Latin word which means heart. The core is the center, the most important part of anything. It's the core part of a proposal, core part of an idea. Think of the way we use the word heart in everyday language. We use the terms heart of gold, heart of stone, broken-hearted, heartache. Let's take this to heart. Eat one's heart out. Set my heart at rest. Set my heart on fire. Does my heart good. At my own heart's content. Have a heart from the bottom of my heart. These are common phrases we use in everyday life. So, you know, the heart is not just an anatomical organ that does stuff. We've integrated the concept of heart into our speech and into our philosophy and into our emotions and how we deal with people and our loved ones and how we communicate. So the heart is not just a physiologic organ. The concept of heart and the concept of how we communicate with people has been around for a long time. And this goes back a long time. You know, it goes back to the ancient Greek and Roman philosophers, you know, where the concept of fear and danger, okay, and running away was related to an excited pulse. They knew that if there was fear and danger and you would have to run away from your enemy, that your pulse rate would go higher. So this was well known by previous you know, physicians in yesteryear, that if you were a fighter and if you had to run away from your enemy, that your pulse would go faster. Okay, and as we got closer and closer to the modern age, okay, one of the founders of modern medicine, Sir William Osler, in Baltimore, you know, really made one of the key observations that one of the indicators, you know, of tachycardia or fast heartbeat, okay, is the engine of your heart is running faster when you're under stress. That was one of the big comments he made. The Meningers, which are the big founders of psychology in Kansas, okay, brought up the concept of psychosomatic disease, okay? What they used the term was a disease process brought on by the mind. Now the concept they brought was a disease that was only in your mind, that wasn't a physiologic disease. Now that was very misleading, okay? Because what the Meningers were saying was that it's a disease that you only think is there, but isn't a real disease. But the concept in modern medicine is that there are diseases that are physiologically based, and stress, anxiety, and adrenaline in your body, which is definitely exacerbated by stress, can increase blood pressure, heart rate, pulse, and make blood pressure more difficult to control if your anxiety isn't controlled. So now we think Meninger was on the right track, but it shouldn't be separated from the idea of psychosomatic as a separate issue. Okay, so the Meninger concept is probably not what we believe in today. Now, we've all heard of the term of a type A personality, right? The kind of hyper, you know, the hyper hardworking person. Okay, that was really coined in the early 50s. So the type A personality is kind of the compulsive, hardworking, you know, person who's the go-getter, hardworking kind of guy who stays up till like 10 o'clock at night, never finished, you know, goal-oriented, hard driver. And it's been well documented that those type of people are very much higher risk for heart attacks, strokes, and sudden cardiac death. And there have been many studies which have been shown that psychological studies in those groups of people who are the hard drivers, the excessive workers, increased work stress, okay, those people also have a high correlation with poor health habits. They smoke more, they're overweight, they don't exercise, they drink more alcohol. So, but even independent of that, when you weed out those poor health habits, okay, they also have a higher risk of heart attack, stroke, and sudden death. There's another group called the type D personality, who's kind of the despondent, poor me, kind of Eeyore kind of person. The poor me, despondent, lonely, reclusive kind of person. Those people also have a third higher risk of heart attack or stroke. So personality traits definitely are related to cardiovascular disease. Stress has been found to be an independent risk factor in addition to cholesterol, smoking, hypertension, and diabetes, just like these other risk factors that I've described. They cause vasoconstriction, those blockages of the blood vessels, just like high blood pressure does, just like cholesterol does, just like smoking does. Just one study to look at very quickly here, and then I'm going to start wrapping up. This study on the left looks at days after discharge. This is a depression scale. A depression scale, and this has been done probably about 50 times now. If you look at people that were discharged from the hospital after a heart attack, and they took a study, a depression scale, and they were graded. This is mild, moderate, this is normal, mild, moderate, severe. Okay, and this is looking at recurrent MI or death as a function of time after they left the hospital after their heart attack. So these people, their score was essentially normal, so these are the controls. So mild depression, moderate depression, severe depression after a heart attack. So if you're depressed after a heart attack, all else being equal, your outcome after a heart attack is a lot worse, the worse your depression after a heart attack. If you have mild depression, moderate depression, or severe depression, your outcome is a lot worse. So we need to address these. So we always talk about depression. We always give a depression screen when people leave the hospital after a heart attack. That's common now. Job stress is a very common thing, and we know this now in the workplace. We do lots of screenings and discussions about job-related stress at work. This is an interesting study. This is the final study I think I'm going to talk about, called marital discord. Kind of an interesting word. And what this study did is this looked at a survey of many women, and it said women who were satisfied in their marriage, women who were unmarried, and women who were not satisfied in their marriage. They did a 10-year follow-up, and they looked at ultrasound of the neck blood vessels. And that's a good marker for atherosclerosis in the heart. They did a 10-year follow-up, okay? Women who at the beginning of the study were satisfied, okay, didn't have very many new plaques in their blood vessels of 10 years. But the women who had low satisfaction, okay, had a lot more progression of plaques in 10 years if they were unsatisfied in their marriage at the beginning of the study. So all things being equal, you know, stress definitely affects your body system. So stress is the body's response to physical, chemical, or emotional, environmental issues. It can cause muscle tension, increased heart rate, body aches, forgetfulness. It releases hormones that can increase your blood pressure and heart rate. It increases, and there's all kinds of things here. And this is a study where a patient had a stress test, and the same patients came back 2 weeks later, and they gave them some complicated arithmetic to do. And they did the stress test pictures the same way they did the stress test 2 weeks before. And look at it. The stress test results were just as abnormal as when they did their stress test. So the stress of doing arithmetic was just as bad as the stress of walking on a treadmill. So if you get stressed out doing arithmetic, if it's hard for you to do arithmetic problems, it's just as bad as you running on a treadmill. So stress can really affect your heart. So that's a nice objective way of looking at it. So ways of coping with stress, and I can send you all handouts on this. You know, eating and drinking sensibly, stopping smoking, exercise on a regular basis, cutting back alcohol. The most important thing is being open and discussing this with your provider. That's the most important thing. If we don't know about it, okay, we can't help you. So we need to ask probing questions, and we need to discuss this with you and discuss ways that we can help you address this. There's relaxation techniques, there's medication, there's biofeedback, getting you to see therapists. There's all ways we can help you. But we can only help you if you give us little hints. And we need to jump on those hints and discuss it with you. You get this, you get to the end here. So this is sunlight from that same picture as the sun came up, and now we get a much clearer picture when we get rid of all the fog and the sun comes up. Down on the inside of Haleakala volcano is about 2 hours later. As the sun rises, we get a much clearer picture as time goes on. And you know, we see that stress now is a major contributor, independent, but also confounding other cardiac risk factors. It's not the only problem, but it's definitely a major contributor, especially as we get older. And these are two phrases I want to leave you with. For every complicated problem, there's a solution that's simple, direct and understandable, and it's usually wrong. So when you go and discuss it with your doctor, it's not always the simple things. You need to discuss it with them, okay? And they can't just like get you out of the office in 2 minutes, because if there's something else going on, we need to know about it, okay? And these 2-minute office visits don't help if you don't tell us there are marital issues, there's financial issues, there's maybe alcohol-related issues of family members that we can help you with. And the Mark Twain quote I thought was awesome. What gets into trouble is not what we don't know, but it's what we know for sure that just ain't so, okay? And that's a lot of big deal for us as providers. We need to keep on changing how we approach things, okay? In the past, we just write prescriptions, okay? To just give you more and more drugs. We need to take a step back and realize there's more to patient care than just giving drugs. And I think we're getting much better at it. I think we're getting much better at providing holistic care, as providing team care, and getting therapists involved, and using ancillary services available to us to better take care of you. And that's our approach here at St. Genevieve County Memorial Hospital. We want to take care of you. I'm not just your heart doctor. I'm a member of a team who wants to take care of you to make sure you stay healthy throughout your life. And if there's anything else I can do to help you and help you as a member of your care team, please don't hesitate to contact me. And, I'll have these handouts. We have water bottles for everybody, and then we can just chat out in the hall for questions. Okay? Thank you very much.
Thank you.
Good morning, ladies. Well, I appreciate all of you being here. So what we're going to do for the next hour or less, we're going to talk about what services Genesis can offer you. As you know, I've been in business with medical aesthetics for probably the last 10 years with an interest that began years ago during my residency. Had plans to go into plastic surgery, but then 1990 was Desert Storm. Some of you are old enough to remember that. And I was mobilized. I had to leave. 3 months I was gone. And when I came back, I made the decision not to go into plastics and to stay here where I've been ever since. And because I love St. Genevieve, of course. So what I have done over the last 10 years is return a part of my time back to where my true love has been, and that's aesthetics. Because I enjoy general surgery, and I plan to do it for a long time, but I may do this even longer, because this is a very nice service to offer. We're located in Bloomsdale. We're part of the women's care business right now. And what we're offering are things that take you back to where you were years ago. There's no such thing as being too old to have this done. However, we try not to do anything in anyone younger than 18 years of age, but some services we can, and we'll talk about that. So over the next few minutes, what I'd like to do is just let you know what we're offering. Mary Cecilia, some of you may know, is working with us right now. She's a registered nurse practitioner with Women's Health, and she's learning a lot of our services and will be working with us as we offer services to you. Patty has been with me for close to 18 years now, and she's sort of my right hand on a lot of the services that we do, and she performs a lot of the services also that we're offering. So our idea is to give you a purpose to improve what time has stolen from you and return you back to your natural beauty. Now, we all know that we can look back at pictures 20, 30 years ago and say, why don't I still look like that? Well, the reason for it is that as we age, time robs us of things that it's just not fair. In the face, for example, the dermis gets thicker, we lose fat, and what happens is things start to drop. Pores open, then all of a sudden with wrinkles and pores, you start to look darker compared to where you were before. Well, we can do things that can back up time. And it's all natural, and it's all FDA approved. The services that we offer, laser-assisted liposuction, we can get rid of cellulite, and this really does work. 85% of women have cellulite. All therapy is a non-surgical facelift. Now, all of you are familiar with what I just discussed, and as our faces drop, that's because we lose collagen, we lose fat. So with a combination of lift and putting in tissue fill, we can return you back, give you those apples you used to have when you were much younger. We do treatment for severe underarm sweating. Sublative rejuvenation is a service that we'll talk about to help your face get porcelain, your skin get porcelainized. Laser hair removal, laser treatment for veins, and we have new lasers that do a remarkable job on this now. And tissue fillers. Everyone knows about Botox, and we've been doing Botox for years. The smart lipo that we do, basically we remove excess fatty tissue. It's done with the use of a laser. Now the way this works is very simple. We sit, we have a consult. We talk about the areas that are important to you, the things, those areas that you want to get rid of. Abs, the most common areas that we do. Love handles. In men, women call them, I don't know, hips, outer thighs, inner thighs. Neck, get it tighter. Arms. You know, when you wave, this keeps moving back and forth. We can get rid of that. It's a minimally invasive procedure because it's done in a clinic. There's no general anesthesia. Don't be afraid of this because the stories about the disasters that have occurred with liposuction, look deep into those stories and you'll find these people that probably shouldn't have been doing it in the first place. But it's a very safe procedure. And we use the laser to melt the fat. We use a little tiny suction device about the size of a straw to suck the fat out. And then we go back and use a laser to tighten the skin. Fat reduction is permanent. This is a permanent procedure. So if you come to see me about removing fat, be sure you don't want it back because you can't get it back. Once it's gone for good. And a lot of people, you know, the idea is, well, if you remove fat from here, where else is it going to go? Well, it's not going to go anywhere because there's no such thing as fat that you remove moving somewhere else. However, you have to understand that most people who want to get rid of fat are already, they've done things, they've dieted, they've exercised, they've done the things they should have done, and it just hasn't been successful by sucking the fat out. Then if you continue to do those things that you have been doing, you won't gain more weight in other areas. You're as thin or as lean as you're going to be at age 18. Every one of you have heard that. What that means is that by the age of 18, every fat cell in your body has matured. Now, you may have been overweight at 18, but this has to do with fat cells. You have a finite number of fat cells, finite, means that you don't gain more fat cells when you gain weight. You feed fat cells, and then they swell. So the number of fat cells in your body has been there, all mature, since the age of 18. That's why when you remove them, they cannot reproduce. But where you still have fat cells, they can continue to swell. Now one of the side effects of removing a lot of fat from the abdomen and removing a lot of fat from around the waistline is that you can get a little bit bigger booties. So that's one of the things you have to be aware of. And a lot of it has to do, excuse me, one second. A lot of that has to do with estrogen. Estrogen works wherever you have fat cells. So if you take a lot of fat cells around the middle, then estrogen is going to work right here. It has more of an effect on premenopausal women. So this is the laser effect, and this is basically what it does. It melts the fat, and then I come in and I suck it out. The results of tightening comes from the laser because laser stimulates collagen growth. The fat is gone immediately. You have to have the patience for the laser to do the tightening, and that tightening takes about 6 months. These are some of the, can you turn the light down? Yeah. This is a real result. This is the result of removing fat, and there was a time when this would have fell down to here, but with the use of laser, just a small little area, and we went back later and did some more tightening. This really does work. This is neck work, arms, non-surgical facelift, old therapy. It is the only FDA non-invasive way of tightening your face. This is not surgery. Actually, Patty performs this procedure. We do the consultation, we talk about what you're interested in, and with the use of an ultrasound machine. All of you are familiar with ultrasound. The transducers are applied to areas on your face, your neck, your décolleté, lower face, upper face. And what happens is, the ultrasound energy is delivered quite deep to the level of the muscle layer, basically where we go if we did a facelift. That laser, that ultrasound goes to that same area. And what it does is it tightens. It stimulates collagen growth. It takes about 3 to 6 months to see the final results of old therapy. Now, both of these procedures do hurt, but we give you pain medication, so they are comfortable when you have them done. And this is just describing what it does. It's just a non-surgical way. There's no downtime with this, so you can have this done and go to a party and no one will know that it was done, because you don't see the after effects. And over 2 to 3 months, you look like a new person. It's everywhere. And these, a lot of these services that we offer, why do you think the stars look so good for so long? They've taken advantage of all of this. They have always taken advantage of all of this. And these are some of the results from our therapy. Cellulite, every one of you in here, well, not everyone, I would say 85% of you in here at one time or another looked in a mirror and don't like the way this looks because it has that cottage cheese appearance. It happens back here, it happens in the front. You've probably spent a lot of money on creams, lotions, outfits, things to make that look smoother. Well, this is the way we can do it with the use of a laser. With a little hole in the skin, basically let me show it, if I can show you, let me see if I can get back to, I don't have a picture to show it, but this is sort of a 3-tier type treatment. What we do is we go with the laser, we melt the excess fat that forms the heels, we cut the little fibrils that pulls the skin down and give you the valleys, and then we thicken the skin by using the laser on the skin. It does take time to do it. It's not as painful as Smart lipo, of course. You're looking at a couple of hours depending upon which areas that you're interested in. But with a consultation, we sit and we talk about it, and I tell you what we can do. This works, this is FDA approved, and it's the only thing out there now that will permanently get rid of cellulite. Skin rejuvenation is just a way to porcelainize your skin. A lot of the laser services we do will take care of fine lines in your face. It will close the pores, and it will give you a younger look. If you have children or grandchildren, and if you take a picture next to them, if you see that child's face, the light bounces off. It makes the face bright. It makes the face look younger. The reason for it, children don't have wrinkles. They don't have pores. They don't have fine lines. All of these things that I'm just mentioned, fine lines, wrinkles, pores, causes shadowing and absorption of ambient light. So consequently, you look darker and you look older. These procedures don't make you look unnatural, because basically it just returns your face, your skin back the way it used to be. Your skin has to do the work. We just stimulate the skin so that the work can be done. This treatment with the rejuvenation, very safe for the skin. You get some tightening with this. Each one of the services that we offer, there's a certain thing that it does. Not all services do the same, but we'll tell you in a consultation what we think you would benefit from. You come to, these consultations are free. The consultations are very laid back. You just sit and talk. I'll hand you a mirror and you'll say, this is what I want you to take care of. And you tell me what you want, and then we make it happen. Sublated rejuvenation is one of the procedures that will improve tone. If you have irregular tones in your face, where you have the browns, the light reds, the shadows, this will smooth and porcelainize your skin. This closes pores, it tightens fine lines, and it gives your face a younger look. This was one of the hottest things when it came out a couple of years ago, and still we do a lot of sublated rejuvenation. Now, when you get this procedure done, your face is a little red for the first 24 hours, so you have to do it and not plan to go out to party unless you'll tell someone you had a sunburn, because it kind of gives you look as though you just had a sunburn. But it does make the skin. So you see what I'm saying? This is what right after treatment, this is pretty much what things are going to look like. But we use this for acne, and it works beautifully for acne scars. We've actually worked on scars, dog bite scars, and it will break down the collagen and it'll make it look smoother. This is a pretty impressive machine. All of you are familiar with laser hair removal. We use lasers that are very safe. Hair grows in 3 cycles, which is why when you start to get hair removal, you can't get it done just once. You get it done like up to 6 treatments. 3 treatments should get the majority of it, but you have to do it at different times to catch hair as it's growing. Now this is great for brown hair, for black hair. It doesn't work very well on red hair or gray hair, or you just have to have hair that is dark, because the laser needs a target. But if you come to us and we talk about it, we'll tell you whether you would benefit from it. All the machines that we are using right now are FDA approved, and these machines really, really do work. We do a combination of treatment for leg veins. We can laser red veins. We can laser those little purple veins that you have. If you have blue veins that are big, we inject it and we get rid of those. So sometimes vein treatment takes a combination of different things, but we use a very effective laser that will help to get rid of those veins that you just don't like having, and you can't wear those shorts you used to wear. But spider veins are the best ones. The bulging, twisted, or deformed veins, varicose veins, we use a combination of injection sclerotherapy with that. And that's the part of it that I do. Most patients need 1 to 3 treatments, but we generally recommend 3 to 6 treatments for it to be very effective. Everyone knows about Botox. Botox has been around. You know, when we had this housing crash, a lot of the services that we offer kind of went by the wayside for a little while. Bouncing back now. But women kept their Botox appointments. We never dropped in Botox. Botox is basically a toxin, safely administered glabella, those frown lines, around the eyes. When you smile and you starburst, well, that takes attention away from the eyes, so we get rid of that. Forehead wrinkles, we can get rid of that. I don't have it right now, as you can tell. Kind of have that Sharpay look. But Botox is very, very safe, and it's been around for a long time. Of course, they use Botox for everything now. You probably have heard about it. Each treatment lasts about 4 months. The longer you get it, the longer it will last. I have people in my practice that have had it done for the last 5, 6 years, and they can go 6, 7 months. Now, the reason Botox works is because what it does is it paralyzes temporarily those muscles that make your face wrinkle and do those things. But it is temporary. It is temporary. And you have to realize that. But this is an addictive thing because it really does work. And the Botox is administered by an experienced injector. Fillers. Years ago, when you probably have seen stars on TV that had facelifts, and you can tell they have facelifts because they look skeletonized. Well, tissue fillers are the way we are now preventing that from happening. Because remember I said you lose a lot of fat in your face. Well, that's exactly what's happening as we age. We lose fat, the skin gets heavier, it drops. By using tissue fill, we can return the volume that you have lost in your face and give you a younger look. Young people have nice apples right here. We can replace those apples. We can take care of these marionette lines where you've lost volume and you get these lines. Right here, you get what's called a pre-jowl sulci. You can fill those. We can get rid of nasal lace. And this is instant. I mean, you walk out and it's done. It's that quick, it's that easy. We use different types of tissue fills. We use Radiesse. We use Juvederm. They advertise a lot. You've heard of Juvederm. And we use Bellateric. These are all forms of tissue fills that work, and they last anywhere from 9 months to 3 years, depending on what areas you can give. We can also give you those pouty lips if you're interested in that. A lot of times, if you bring me pictures of the lips that you would like to have, I can a lot of time I can do this. Depending if you have the lip form, I can make you look like those pictures a lot. It's pretty interesting. Radiesse is one of the volume replacers that we use, and basically this is the one that may last the longest. Bellaterra is used for very fine lines. And by injecting into this area, it basically fills it, and we straighten it out. And those are the areas that we can do anywhere that you have fine lines. All of these services, as I mentioned, that we offer are FDA approved. I do not use anything off market. Everything is on market, and the FDA has said it's okay to use it with the way we use it. All of you have a certain beauty, every one of you. If you look in the mirror, the eyes never really change. We're talking about face. The eyes retain that gleam. It retains that bright, that really youthful look until you're 80 years of age. Now, what we do is try to bring attention back to the eye. Pay attention when you walk around, and you will see that if you look at an older person, where you're going to look is right here, because of the volume loss. You're gonna look around the eyes. But if you look at a child, where are you gonna look? Directly into that child's eye, every time. Think of the children you see. You don't really know what the face looks like as much as the eyes, because in a child, your attention is drawn right to that child's eyes. The services that we offer for like facial rejuvenation is we get rid of those things that take attention away from the eyes. You have that, all of you have a beauty, and that beauty is still there. And what you've lost with time can be erased with a lot of these services that we offer. The services are very safe. We sit down, we talk about what we're going to do, and we work with you and provide whatever we can provide for you that will make you happy.
And what other ways besides surgery is there to fix ptosis, like a droopy eye?
Droopy eyes are a consequence of just losing some of the muscles that are getting kind of lazy. All-therapy. Were you here earlier when we talked about it? No, that's okay. All-therapy is a way of tightening skin, and if your eyes have a tendency to fall and droop over, with the use of all-therapy, we can tighten the skin above the eyes, above the brow, and give you a lift that'll last. Oh, I'm sure you probably was wondering how long that lasts. That lasts anywhere from 5 to 8 years. Now we can put Botox here and get rid of those opposing muscles, and you get a lift just from the Botox. However, that's temporary. That's about 4 months, and every 4 months you have to have that repeated. However, if you want a long-term eye lift, then you get basically a lift from a procedure that we do that just tightens the area above. I think it's a good investment, you know, when you want to do something like that, because using Botox to just lift your eye, that's something you have to keep up with. But by using all-therapy, we can have that lift, and you can maintain that lift for a long time.
How expensive is that?
Oh. The question everybody's wondering. Yeah.
The more you get, the more it costs.
That is true. I frequently tell people when they come into our office and they start to hear the services that we offer, it's sort of like walking into a candy store, you know, because you can pick so many things that you can have done. The cost depends upon what you're having done. You can have things done, honestly, anywhere from $200 to $2,000. Some of the services that we offer, you know, will get you in the thousands. But a lot of the services, the tissue fill, Botox, you can do it for a reasonable price. Botox works up until the age of 66. That's what the company says. But I will tell you that I have ladies that are 72 to 74 that get Botox, and it does work. So it will work. When you're over the age of 66, I can't promise it's going to give you the same effect. As far as smart lipo, that may be one of our most expensive procedures because it takes a lot of work. For example, if you're interested in having your abs done, that's about 4 hours of work. The stomach takes a lot of time, but that's the area that most people are worried about. Very safe procedure to do. That may be a little bit more expensive. And the cost depends upon what you're interested in having done. When you come in for a consultation, we basically talk about what you're interested in, and we give you a sheet that you can take home with you. We tell you the things that are going to provide you with what you're looking for, and we put the prices on it. So you pick and choose, and you do what you're interested in. But it's all affordable. I don't know if I answered your question.
And well worth it. It would be worth it.
It's worth it. Yes, it is. It's well worth it. We have very happy customers. You know, people that come to see us and have things done, they become very loyal. They come back again and again because, you know,
Makes you feel better.
makes you feel better. If you look good, you feel good. One of the things that a lot of people are concerned about, you know, vanity. Vanity is it too vain to do things that make you look better? Well, I mean, you do a lot of things to improve where you are. You exercise, you diet, you try to eat right. You go to your doctor to control your blood sugar, your blood pressure. Well, looking good makes you feel good. You know, it's depressing as we age and we look in the mirror. Let's face it, I mean, I feel it, we all do. You look in the mirror, you're like, what's happening to me? You know, why is this happening? You know, you look at your mom, you look at your dad, especially ladies, look at mom. You know, you will look like mom. But what you can do, and there's nothing wrong with that, but you can slow the process down. And these services slow the process down and place you, they back you up. Now, you don't look any worse. Let's say you come to me and you get tissue fill, you get Botox, you get oral therapy, and you say, now what's going to happen to my face when all of this is gone and I decide not to do it anymore? Well, you go right back to where you started. Gradually, it takes a while. It won't make you look any worse. You're just going to look, you're just going to back up. That's about it.
Well, since I mentioned the cost, are there any insurances that cover this?
Unfortunately not. No. Insurance is, the only thing insurance may cover would be Botox for migraine headaches that we don't do right now, and I'm thinking about getting into that. And that's one thing insurance would help with. But there are things insurance should help with. For example, severe underarm sweating. We have something for that. We use Botox, and there's also a way of doing it with the use of a laser. You know, and that's a very embarrassing thing. Some, especially I see a lot of young people have that, where they can't get rid of underarm sweating. Well, we can't erase that. You know, by using Botox, you can stop that in 7 months. So I have people regularly who will come in the beginning of the summer because they'll take them through the summer. Or some people who have underarm sweating year round, you know, we could use a laser machine to stop that for long term. And both of the services that we offer for underarm sweating does last quite a long time and is very safe. Well, visit our booth. We're upstairs. We have a new laser. If you've had hair removal done or veins taken care of before, you may have found it to be very painful. We have the new laser that has a coolant to it, and that will provide it, that will make it a whole lot easier to have it done